Hello and welcome. Our topic today will be on CPR, that is cardiopulmonary resuscitation. We'll also talk about AED, automated external defibrillator, and finally we will look at FBO, foreign body obstruction. Welcome. Let's learn together. So now let's begin with cardiopulmonary resuscitation. It is also known as basic life support. This is the procedure done to provide oxygen to the brain, heart, and other vital organs until circulation returns or assistance arrives. The formula that we usually use is compression, airway, breathing, CAB. Compressions, airway, and breathing. Before using the formula CAB, first determine the responsiveness of the client prior to the formula. Assess for the consciousness, assess for the carotid artery, then continue with compressions, airway, and breathing. For the compressions, ensure that the victim is lying supine on a firm surface. Stand or kneel beside the victim's chest. Place the heel of one hand on the lower sternum with the other on top. For adult compression, the depth is usually 2 inches at a rate of 100 per minute. The ratio of compression to breath should be 30:2. 30 compressions, 2 breaths. 30 compressions, 2 breaths. The other thing you need to establish is a patent airway. Establish a patent airway prior to delivering breaths. And for the airway, you need first of all to wear appropriate equipment, that is the gloves and face shield. Then there are maneuvers that you are supposed to use. Number 1 is head tilt. This one you place one hand on forehead to tilt the head back. Then the chin lift. Chin lift, first and the second fingers of the other hand are used to lift the chin. There is another maneuver called jaw thrust maneuver. This one is used if the head, neck, or spinal injury is suspected. From there, you continue to breathing. And this is where you give 2 breaths. Each breath should last 1 second. Allow the victim to exhale between breaths and avoid excessive ventilation. Then watch for visible chest rise. The other thing you're going to look for is abdominal distension. Why? It occurs as air enters stomach rather than the lungs. Now let us look at different variations of cardiopulmonary resuscitation. We are going to look at the maneuver that is used in adult, child, and an infant. Where do you check the pulse? In adult, you check for the carotid artery pulse. For the child, carotid or femoral artery. In an infant, you check for the brachial artery. Compression landmarks. How do you determine compression landmarks? For an adult, the center of the chest between the nipples. That's where you are going to place your hands for compression. The center of the chest between the nipples. And it's the same for the child. Center of the chest between the nipples. But for an infant, you have to go below the nipple line. Below the nipple line. What about compression depth? For an adult is 2 inches, and that is the same for the child, 2 inches. But for an infant, you go deep 1.5 inches. The compression rate for both for adult, child and infant is 100 per minute. The rate at which you are doing compression is 100 per minute. What about airway breaths? For an adult, you do 1 breath every 6 seconds. For a child, 1 breath every 2 to 3 seconds. And that is the same for infant. 1 breath every 2 to 3 seconds. For the foreign body airway obstruction, the maneuver for the adult is back blows and abdominal thrusts. And that is the same for the child. Back blows and abdominal thrusts. But for an infant, is a bit different, is back blows and chest thrust. Note the difference. Here it is chest thrust, not the abdominal thrust. Chest thrust for an infant. Quickly, let us check on automated external defibrillator. This is a device used to convert ventricular fibrillation into a rhythm that allows perfusion. You attach leads to the victim as per the instructions, turn on the AED, and follow the prompts. Ensure that the victim is not being touched when the shock is delivered. When there is a shockable rhythm, do CPR for 2 minutes after the shock. For unshockable rhythm, do CPR for 2 minutes and then assess the rhythm every 2 minutes. When using AED for an adult, do not use child pads. However, adult pads can be used for a child. Now let us look at foreign body airway obstruction for an adult. If the victim's airway is partially blocked, encourage coughing. If the victim is experiencing dyspnea, begin cycle of 5 back blows and 5 abdominal thrusts. 5 back blows and 5 abdominal thrusts until the object is dislodged or the victim becomes unconscious. And when the victim becomes unconscious, begin CPR for 2 minutes. Airway is continuously assessed for identification of the foreign body. Foreign body airway obstruction for an infant or child. Remember, choking is assumed if an infant or a child is experiencing respiratory distress. There is coughing or stridor. Encourage the child or the infant to cough. And if coughing is ineffective or the victim exhibits dyspnea or a high-pitched noise while inhaling, start for a child 5 cycles of back blows and 5 abdominal thrusts. But for an infant, it's the other way. That is below 1 year. If an infant below 1 year, you will do 5 back blows, a cycle of 5 back blows and 5 chest thrusts. And you are going to compress below nipple line. When you're doing the chest thrust, you're just going to compress below nipple line using 2 fingers until the object is dislodged, the child can breathe or becomes unconscious. And remember, when the child or the infant become unconscious, what do? You start CPR. What about foreign body airway obstruction for pregnant women? For a pregnant victim, chest thrusts are performed. Not abdominal thrusts, but chest thrusts. The rescuer places arms under the victim's axilla and over the chest. A clenched fist should be made with one hand and covered by the other hand. If a pregnant victim becomes unconscious, she should be placed on her back with a wedge under her right hip to displace the uterus to the right. Then ventilations are attempted, but if unsuccessful, compressions are initiated. Thank you so much for watching this video. I hope it has been of value to you. It has reminded you a bit of tips when you look at cardiopulmonary resuscitation, use of an AED, and foreign body airway obstruction. We are going to post more videos on various topics. Kindly check us on YouTube, like, subscribe, and leave a comment. Thank you. Bye.